All right, let's talk about something that is, and I am not exaggerating here, a life or death question. It's about combining certain heart medications with ED medication, and it's something everyone needs to understand.
So let's say you're taking a nitrate medication, something like isosorbide, to manage chest pain or angina. It works by widening your blood vessels. And you might be thinking, hey, wait a minute. If it widens blood vessels, could that also help with ED? It seems like a logical connection, right?
Well, the answer to that is a hard, fast, absolute no. There are no ifs, ands, or buts here. This is one of the most serious and dangerous combinations in all of medicine.
And look, this isn't just an opinion. The entire medical community is unanimous on this. As Bolt Pharmacy states very clearly, taking these two types of drugs together can cause a dangerous drop in blood pressure. And that word dangerous is frankly an understatement.
Okay, so let's get into the nitty-gritty of why this is so incredibly threatening. Because once you understand the why, you'll never forget the warning.
You know, in the medical world, they have a special term for this. Absolutely contraindicated. That's not just a fancy way of saying be careful. It's a strict, ironclad rule. It means these two drugs should never, ever be in your body at the same time. Period.
So, to really get why this is such a big deal, we first need to look at what your heart medication is doing all by itself.
So, your medication, isosorbide, is a nitrate. Its whole job is to prevent angina, that awful chest pain that happens when your heart's not getting enough oxygen. And it does that by being what's called a vasodilator. It just means it relaxes and opens up your blood vessels.
And it works in this really clever three-step way. First, it relaxes blood vessels pretty much everywhere in your body. This makes it easier for blood to flow back to the heart. And because of that, your heart doesn't have to work nearly as hard, so it doesn't need as much oxygen. Boom, no more angina pain.
All right, so that's what your heart med is doing. Now here's where the problem comes in. What happens when you throw an ED pill into that system? And this is the absolute crux of the issue. You've got two different drugs, but they're both pulling the exact same lever. Your nitrate is widening blood vessels to help your heart, and the ED medication is also widening blood vessels to help with an erection. So when you take them together, you get this crazy multiplier effect. It's not 1 + 1 = 2. It's more like 1 + 1 = well, a disaster. Your blood vessels open up way too much, and your blood pressure just plummets. This is called severe hypotension, and it's a medical emergency.
And let's be crystal clear. We are not talking about feeling a little lightheaded. The consequences here are catastrophic. When your blood pressure crashes that hard, your brain and your heart are starved of oxygen. This can lead to fainting, a massive heart attack, or a stroke. It's why this is a life or death issue.
Okay, I know that sounds incredibly scary, but the good news, and there is good news, is that you are not out of options. Not by a long shot. There are plenty of safe ways to address ED. You know, a lot of the time, the best place to start isn't even with another pill. Things like regular exercise, losing a bit of weight, and cutting back on alcohol can make a huge difference, and they're great for your heart anyway. Sometimes the cause is psychological, or even related to muscle strength, and there's help for that too.
And for those cases where a medical approach is needed, there are some really great, safe alternatives that your doctor can discuss with you. These are things that won't interact with your nitrates. We're talking about things like vacuum devices or localized medications like alprastidyl that work right where you need them to without affecting your whole body's blood pressure.
So, the big question is, how do you get started with one of these safe options? Well, it all boils down to one simple, crucial step: talking to your doctor.
And look, I get it. It can feel awkward to bring this up, but I want you to know you are so far from being alone in this. About half of all men between 40 and 70 deal with ED to some extent. Trust me, your doctor has this conversation all the time. It's just another medical condition.
Think of it this way. Managing your health is a team sport. The goal isn't just to keep your heart safe. It's about making sure you can live a full, happy life. It's not a choice between one or the other. You can and should have both.
Your GP is really your partner in this. They're the one person who can look at the whole picture, your heart condition, your other meds, your lifestyle, and help you find a solution that actually works for you and is 100% safe for your heart.
Okay, before we wrap up, we need to cover one last thing. This is the absolute worst-case scenario, and you need to know exactly what to do. What happens if you've taken an ED drug and you start having chest pain?
The steps here are non-negotiable. You have to follow them to the letter. First, stop everything. Immediately. Second,
call 999. Third, and this is the most important part, you must tell the paramedics that you have taken an ED medication. Why? Because the first thing they often do for chest pain is give you a nitrate spray. And in your situation, that could literally kill you. And of course, do not take your own nitrate pills.
So it all comes down to this one question, really. Your health, your safety, and your quality of life are all on the line. And the path to protecting all of them begins with one simple, honest conversation with your doctor. It's absolutely worth it.